at Lauren when we get old.
We are back on Morning Line. We're talking about what type of plans we're going to take at some point. And like she was saying, if the time comes for you, you might look at doing a original Medicare with a supplement because maybe you want to travel, so you want to have some options for yourself. It just comes down to tailoring what you need and what you want, and that's what SHIP is here for, and that's why Shannon Jones is taking your calls this morning. And let's take Bob real quick here. Bob, good morning.
Good morning.
Hi, Bob. Go ahead.
All right. I'm on a plan, AARP Advantage, but they're cutting out a plan for the D part starting next year. I guess I'm pretty much covered, but I've been paying in, and also the question is, how much would the supplement probably run? The question, to get the supplement for the regular Medicaid or with the plan I'm with.
Okay, good question, Bob.
That's a really good question. There are some Advantage plans. And AARP may be one, I don't know off the top of my head. There's about 2 or 3 that do not have drug coverage.
Okay.
Now, those Advantage plans, we would only recommend that if someone has VA benefits and knows that they are going to go to the VA for all their prescription medication. But if Bob does not have VA access, then this is the time of the year that he needs to run an Advantage plan comparison and see which plan he needs to enroll in, because he has to have drug coverage if he's not entitled to VA benefits. And if you stay with your current plan that doesn't have drug coverage next year, then there is a penalty, and that is based on 1% of the average benchmark for a drug plan premium, which is around $32 this year. So that'd be 32 cents for every month he should have had drug coverage, but he didn't.
Now, is he able to buy a supplement for his Advantage plan?
No.
No. So he needs to change to another Advantage plan possibly, or go to Medicare with a supplement.
Right. Those are his choices. So I'd first look at...
So why would this one be dropping the drug coverage if he's going to lose all their clients?
I don't know. We'd have to check with the insurance company to see.
But does that happen sometimes? Why would... I mean, do we see that? I mean, he's had this and all of a sudden they're thinking, oh, we're not going to offer prescription drugs anymore?
I have not seen anyone drop their drug coverage. I've seen plans that never intended to have drug coverage.
Okay, so why would I even consider one of those plans if I'm going to be penalized for not having drug coverage?
The only reason you would want an Advantage plan without drug coverage is if you could go to the VA. That's the only acceptable reason Medicare will take. Otherwise, you'll be penalized.
So what you recommend Bob do between now and December 7th is maybe, I don't know, you can call SHIP and we'll put the number out or whatever. Start looking at maybe some other options, which, Bob, you know, your new plan, if you look at it, might save you even more money, but he needs to find something with a drug coverage.
Right. So you have a choice. You can find another Medicare Advantage plan.
How many of them are there out there?
Well, you know, I didn't count, but there are 24 standalone drug plans and probably 25 to 30 Medicare Advantage plans, different plans that are available. But if you did want to look into original Medicare, you would need to contact an insurance agent to see if they would even sell you a supplement policy at this point, because supplement policies, the open enrollment for that is when you enroll in Part B, and that's the only time they don't take into consideration medical underwriting or pre-existing. So what will happen now in Bob's situation, when he checks on a supplement, then the companies may say, okay, we'll write you a policy, but because you have diabetes or because you have heart disease, we're not going to cover those conditions for up to 6 months. And because you have those conditions, we're going to charge you an additional monthly premium because you missed out on the period where we wouldn't take all that into consideration.
I see. Boy, you want to stay healthy, don't you?
That's right.
Stay healthy. But not everyone has that option, you know. We do the best we can. Let's go to Fran. Hi, Fran.
Good morning. How you doing?
Good morning, Fran. How can we help you?
I want to ask the lady if she could explain to me what the special needs program is, because I had was with Hill Spring, and things was going up, and being on disability. On fixed income, I couldn't afford a lot of this stuff, and I was having to change everything, the drugstores and all of their doctors and all. So I was watching TV the other day. It was last Thursday, and this number came up on TV, so I called it. So they sent somebody out here yesterday, and I talked to them. So I changed mine yesterday because everything that they had stopped on Signal Hill Spring, it's on everything that I was on from the beginning is in this program, and it's a whole lot cheaper, I'm satisfied with that program. But he said something about a special needs. Said I should have been on the special needs program already. So he put me on what you call a special needs program, reason why everything came out the way it did. And I wonder if she could explain to me what the special needs program is all about.
Okay, Fran?
Sure. So a special needs plan is an advantage plan that is designed for folks that not only have Medicare, but also have Medicaid.
Okay.
And so these plans have caseworkers to help this group of people make sure they do go see the doctor, and so it's a little bit more intensive, but you do have to have Medicaid
Explain, if
and
you
Medicare.
would, for folks, just what Medicaid is.
Okay.
Yeah, I mean, just the basics. I know,
Sure.
but
The way I keep up with it is Medicare is health insurance care for folks that have earned it, paid into it, starting at age 65,
That's right.
or the other two categories we mentioned earlier. Medicaid is aid to the poor.
it's a safety net.
Yes. And so it sounds like what she's doing is really a good thing for her, because this way she will not only save money, but she'll also get a little extra assistance in making sure that she's getting to the right doctors that she needs. And she mentioned there are some programs, they're called Medicare savings programs, that help pay for co-pays and the Part B premium if you qualify, and they're based on your financial situation. So if you're single and your monthly income is around $1,400 and your savings is around $13,000, you would qualify for extra help. If you're married and your monthly income is $2,000 around, and your savings is around $27,000, then you would qualify for extra help.
When you
And
say-
that's actually through Social Security.
Wow. Okay, and that's good to know. Those numbers. By the way, when you say savings, when you say 27,000, you mean $27,000 in the bank?
Right. Savings, CDs.
Anything like that, as long as it's under that amount.
Right.
Ah, good. All right, let's go next to. We have another Bob. Hi, Bob. Hi, Bob. How can we help you?
I'm listening to your program, and I want to thank y'all for providing this. This is so helpful.
Sure.
But I'm a veteran. I served in the Navy for 4 years during the Vietnam conflict. And one of the things you mentioned was that a veteran could possibly have drug coverage with the VA. I was talking to one of my neighbors who's quite a bit older than I am, and he served like the last year and a half during the Second World War, and he wasn't in conflict. He didn't need to have any kind of ongoing service after he got out, but he went to the VA and they gave him this drug coverage. My question is, because I'm a veteran with 4 years of service and an honorable discharge, can I go to the VA and get drug coverage?
Unfortunately, Bob, I don't work with the VA, so I don't know the exact qualifications, but I would definitely check into it and see if that is going to be an option for you, because it can be a great cost savings.
Yeah, I mean, now you've dealt with some veterans who call you at times.
Right.
I mean, have you? Obviously, it comes down to the question of how long he served. I can't imagine that 4 years sounds like a lot of time. He said he served for 4 years. I don't know, Bob. Well, I think he just hung up, but. Where would he go to find that out? I mean, does he just call the VA?
If he's already
here in
receiving
town?
Medicare benefits, in the Medicare and You 2017 handbook
Okay.
that they that every Medicare beneficiary receives. If they're already enrolled in Medicare, you should have received that in the mail. If you didn't, let me know and I can send you one. But it has the numbers for the VA benefits. It also has the number for TRICARE. If someone is eligible for TRICARE, then their Medicare decisions are a little different as well.
Okay, so the answer, I guess, to your question, but we couldn't answer it straight up, is that there's certainly a possibility that you could, and why wouldn't he? That would be great.
Absolutely.
Sounded like he was thinking, wow, this would really help me out. So definitely look into that. If he served 4 years and was honorably discharged, I would imagine it's just worth looking into. Okay?
Absolutely.
Just do that. Listen, we'll take a break. When we come back, more of your phone calls as we wrap up our final segment with our guest from SHIP right after this.